Let me just start by saying that most people have never heard of a clinical neuropsychologist or know what a clinical neuropsychologist does. And the best way to explain what a neuropsychologist does is to actually look at the name, and that is neuropsychologist. So we are doctoral level individuals who are trained specifically in the evaluation of brain functions, and that's the neuro part, as well as the evaluation and treatment of psychological components. And within concussion, we see both aspects come through quite frequently. Individuals who are having neurological or cognitive thinking kinds of issues, as well as psychological issues related to perhaps anxiety, depression, frustration, anger, and a number of other concerns. So neuropsychologists are specialists in really working with both ends of the spectrum that end up manifesting themselves in concussion.